Well, hello there. I am Dr. David Geier, orthopedic surgeon and sports medicine specialist, joining you for our monthly Ask Dr. Geier Live segment. I apologize on the front end. I'm a few minutes late getting started, but quite honestly, clinic ran long. We have the aftermath of Hurricane Florence over here on the East Coast and had a bunch of clinics get canceled, and so just had a lot of people we had to work in today, so I apologize that it ran a little bit long, but it is what it is. I will tell you on the front end, I'm going to answer questions for about 15 or 20 minutes. It's going to be a little shorter than normal because hey Leslie from Wisconsin, good to see you. It's going to be a little short because I took the red-eye flight home last night and wasn't able to sleep at all, so I am exhausted and I'm probably going to sleep here fairly soon. Couple rules that I always tell people about this. Two things basically. One, I can't give specific medical advice. I haven't seen you as a patient. I haven't examined you. I haven't looked at x-rays or MRIs. Everything I share here is going to be for general information and educational purposes only. So you're better off asking questions. Hey, David from Brazil, very cool. Glad to have you. Couple things, so when you ask questions, ask them in a way that I can answer generally. Like, what type of graft do you like for ACL surgery and why, rather than what type of graft should I use for my ACL surgery. So this is, again, general information and education, but I think it'll be information that can help you basically understand your injury and maybe know what to ask your doctor. Second thing, try to keep your questions short. One or two lines, one or two sentences maybe. I can't read these really, really long questions. Nobody wants to hear it, quite honestly, so do keep your questions short. So that's what I've got to say going forward. Like I said, I'll be doing this for about 15, 20 minutes. So ask your questions, sports questions, exercise questions, things like that. I do want to get to a couple that were sent to me today, and I thought it might be a good way to get us started. So MGM asks, my knee has dislocated 4 times because my knee gets in a weird position. It really hurts and I can't move it. So I suspect that's, I didn't bring my models over here. Hang on. When you say the knee dislocates, my guess is, this is my little knee model, that's the kneecap dislocating, a patellar dislocation, not the whole tibia shifting out from under the femur, a true knee dislocation. So usually, and it's completely cool to, I'm not being critical, but when we hear people all the time that come into my office that say, my knee dislocated, what they're really talking about is a patellar dislocation. Non-surgical treatment does relatively well with making that better in terms of physical therapy, maybe wearing a brace, things like that, and maybe half the time that works. But once it gets into a recurrent situation where it just keeps, the patella keeps popping out, keeps dislocating, you're probably going to end up in a situation where surgery, like maybe an MPFL reconstruction, which we can talk about another time, can be really helpful. So that may be something to look into there, MGM. All right, saw a couple of questions. Let me see. We got Irish Countryman. I am good. Glad you're here. I don't know what your name is, but I will just call you Irish Countryman. Richard Torres, how long should I wait to get back to playing soccer once I start physical therapy for a Jones fracture? I don't know, and this gets back to, again, I haven't seen you or examined you, so I don't know. My answer would be when the fracture heals is when you can start trying to jog and play sports. You're seeing there have been a number of pro athletes in the U.S. that have suffered recurrences of their Jones fracture. That's the 5th metatarsal, the long bone on the outside of the foot, where they must have been allowed to go back to sports before that bone was completely healed, and then they end up having to have a second surgery. So I don't let my patients run until that fracture is healed on x-ray, be that 6 weeks, be that 8 weeks, be that 10 weeks, whatever it takes. That's what you do. Just because it's not worth the risk. Osama, I just did ACL surgery and meniscus. What do you suggest for physical therapy? So this is probably a bigger question than I can answer here, but I mean, there's a detailed protocol that people go through. Early on, it's getting motion back. You want to get full extension almost immediately within the first few weeks and start to get flexion. How much flexion you're allowed depends on what the surgeon had to do with the meniscus. So that probably a good question for your surgeon. You're also getting strength back, and that really becomes the second phase. Then around 3 months, typically you start jogging, you start sport-specific drills, you start landing and cutting and agility and all that kind of stuff. And overall, people can often get back around 6 months back to sports, but that can take about 9 to 12 months. It's a long process. All right, let's see. Sorry, my phone is being slow. Reza asks, 2 millimeter radial head fracture blocking motion in 21 days. Yeah, that can happen. I'm a little surprised with only a 2 millimeter fragment. Typically, radial head fractures very often don't need surgery. They can just heal on their own, but if they're blocking motion, that potentially might be a reason to do it. I don't do a lot of that. That's more the trauma surgeons and the shoulder and elbow surgeons. But those are tricky because there's a lot of nerves and bad things down by the radial head. So you do whatever you have to do to try to get that radial head to heal. Leslie, I was diagnosed with shoulder impingement. My doctor wants to perform a chromioplasty to correct this. What's the average time frame for recovery? That's a good question. So I say this, and I'm going to answer it, Leslie, in response to impingement, but and a chromioplasty. But I say this a lot of times when I talk to my patients about whatever the surgery is. And there's recovery in a short-term sense, and then there's the recovery in a long-term sense. And it depends on what you're kind of looking at. Short-term, getting back to work, getting back to just daily activities is fairly quick. With an acromioplasty, assuming there's no rotator cuff repair or labral tear that has to heal, then you usually don't have to wear a sling more than a few days. Patients can use their arms, start walking around, going to do things around the house, outside of the house. They can start driving potentially and then going back to work. So daily activities may be a few days to a few weeks, but until they're lifting overhead, doing repetitive activities like painting or combing their hair or playing tennis or golf, that can take a little longer. So I usually tell people with a chromioplasty, you're probably doing everything you want to do around 6 weeks, maybe 8 weeks, but it's probably going to be 3 or 4 months, maybe even as long as 6 months before it feels as good as it's going to feel. So in terms of what's the full recovery, maybe I go that way. All right. Christian, whoa, I'm sorry if I'm saying that wrong. It's just really small on my screen. Is it okay to stretch, do yoga while recovering from a knee injury? So yoga is an interesting thing, and I've had this discussion with a patient, not today, but not very long ago, and it was, can I do yoga after, I forget her surgery. I want to say it was meniscus, but I can't remember. And generally, yoga is fine. There's a couple things with yoga, though, that you have to kind of keep in mind. One, a lot of the poses are putting weight on one side or the other and not equally between both sides. So if the side that you're putting all your weight on is on the surgical side, that could be kind of tricky. So I don't tell people they can't do it. They just may have to modify that. Also, a lot of those positions require a very, very deep knee bending, and so that can be a challenge early on. And so I usually tell people you may have to modify the exercise, so maybe you don't squat as much or you don't bend your knee quite as much. So something like child's pose can be kind of difficult. A little of that, Christian, probably depends on the type of surgery, but generally I don't have any big problems with yoga, and I actually think yoga can help you get your motion back. Muhammad, hi doctor, what's the most effective therapy for sacroiliac joint pain? That's a good question, and there's no one therapy that I would say. Honestly, I usually, before I start talking about medicines or injections into the SI joint, and I don't see this as much as the spine surgeons see it, so I'm probably not as good to ask as they are, but I have people actually go to physical therapy and work on stretching the pelvis and the muscles around the pelvis and the lower back, and a lot of times that's enough to get it better. Then if that doesn't, if you need more than that, then you're thinking about injections, you're thinking about anti-inflammatory medications. Fortunately, that rarely needs surgery. All right, son, just follow the physical therapy period. Don't do anything stupid that can damage the surgery. Generally, I don't know who that was a response to, but yeah, I'm a big fan of physical therapy. Zuck, and that may be initials for something, Zuck. I'm just going to go with Zuck. I had tibial tubercle fracture. I'm 15. Any exercises you can suggest to get my quad strength back? So that's an interesting thing, and I don't know if he had surgery. The tibial tubercle is, so you see the kneecap, the patella tendon attaches to this bony prominence on the front of your tibia, and that's the tibial tubercle. And in 14, 15-year-old, maybe 16-year-old boys, typically basketball players, you can land awkwardly and pull that little piece of bone off. A lot of times that actually needs surgery. The key is that you're going to want to get your quad strength back while limiting the amount of shear and a lot of force on the tibial tubercle. So this is one, because this is going to depend on how far out you are. Did you have surgery, something like that? But you're going to want to do, I think, what's considered closed chain activities, where your foot is fixed either to the floor or to like a plate. So leg press would probably be okay. Squats would probably be okay, as opposed to the knee extension machines. But again, that's one that I would definitely check with your surgeon and your physical therapist, and then find out what they think is okay, and then go from there. Yeah, 9 months out, he followed up, had surgery 9 months ago, then it's probably fine to do just about anything quad strengthening wise. Still, leg press and squats I think are tremendous. I think lunges, I think knee extensions at that point are probably fine. I think most of that is okay. All right. All right, Simon Young had a bone patella tendon bone ACL reconstruction 8 months ago. My recovery's been great. It's going away, but I have noticed more anterior translation on my repaired side. Is this common? It can be. I mean, I don't know necessarily that's something that the only way you would really know is either the doctor examining them feels the surgical side and then the uninvolved side. And I think what he's getting at, let me see if, I don't know how well this is going to show up online, or on video, but basically pulling the tibia forward, it's how much that comes forward. The ACL limits that motion, so it should only be maybe a millimeter or two. There are devices, the KT1000 actually checks that. I don't know really anybody that does that anymore, but you can see a couple, 2, 3, 4 millimeter difference. We don't really know what to make of it, because if the knee's not actually giving out, I don't know that I would do anything about it. I mean, I guess it's a little surprising, but I don't know that it would change what I do if the patient's doing well. All right. Ujwal, I apologize if I said that wrong. After my ACL and meniscus tear in my left knee, after how many months can I run? So I was just talking about that with somebody else. Again, ask your doctor, ask your physical therapist, because it's different depending on how long it takes to get your motion back and your strength back. But generally, we say about 3 months for most patients. And that's because the graft before 3 months is not strong enough to withstand the repetitive impact with running and the microscopic stress on the graft. So I don't know many physical therapists that will let an ACL patient start jogging before 3 months, or at least not much earlier than 3 months. All right. GA, it's been 1 month after my knee injury. I think I had an MCL tear, maybe meniscus too. I have no idea. I still can't return to play soccer. Sometimes my knee goes onside and then comes back. I'm not sure what that means. It sounds like the knee's giving way. I would go, and I apologize, I don't know. I'd go see a doctor, find out by exam, by x-rays, even an MRI if it's needed, what potentially the options are as far as getting over that. There's too many variables there. I just don't know. Without knowing what the injury is, I can't really tell you what the next step would be. All right, Irish Countryman. Love that channel name. Should you refrain from any heavy weight exercises involving leg muscles while waiting on ACL surgery? So that's an interesting debate. Generally, I say no. I think that things you're going to do in the gym, at least, are not going to cause your knee to give out. That's what you want before ACL surgery. You just don't want your knee to give out. So squats, leg presses, I would stick to closed chain things like we were talking about earlier, but squats and leg presses, and I don't think that heavier weight's bad. I think if you really want to optimize your quad strength going into surgery, at least from what I've seen with my patients though, lower weights and higher reps for that purpose only right before surgery typically is good. Ujwal, you're very, very welcome. Simon, oh man, you ruined it. I hadn't watched the game yet. I have it on my DVR to watch later. No worries, Simon. Oh, that bums me out. I was trying to go this whole live chat without finding out the score. I should have said that earlier. Big Liverpool fan, in case you can't see the scarf and all the, where is that? Can you see it? Liverpool, and I got a Liverpool scarf over there. I've got like 15 jerseys in my closet, so big Liverpool fan. Where are we? Reza, why don't doctors perform closed reduction for broken bones in adults? We do. I do that. I don't take ER call anymore, but when I did, I would do closed reductions for like wrist fractures, and sometimes for ankle fractures. But the difference is a lot of times for adults, you're going to have the ones that you have to reduce, you're going to have to turn around and fix by putting plates and screws or pins or whatever it is. So a lot of times we'll just do it all in one step in the operating room. But there is an occasionally where, like especially with wrist fractures, you'll do a closed reduction to line it up better and then cast it or put it in a brace or something like that. All right, a few more we're going to do. You're welcome. And no worries, Simon. It makes me feel better that we won. That I had a rough day today, so as you heard at the beginning of this, so I'm pretty excited. Kelly was recently diagnosed with ostrigonum. Yikes, in both feet. I play softball. It's interesting. Usually you see that in dancers. I play softball. We'll be getting surgery on my feet in October. Will I be able to play in March? How long's the recovery? So, all right, this is going to depend a little bit, and this I would go talk to your surgeon. It depends a little bit on what the surgery is going to be. If it's just taking out that accessory bone, then the surgery should be fairly quick. I think 6, maybe 12 weeks tops. If there's anything else that has to be done, and sometimes I've seen, and I probably defer those surgeries to the orthopedic foot and ankle surgeons. But having said that, sometimes it gets into surgery where they have to do stuff, something to the tendons too. That's where it ends up starting to take longer. If it's just taking that accessory bone out, though, it may not be too long. All right, I'm going to answer a couple more if anybody have questions, and then I am going to head out tonight and stuff like that. Tony, hello, good to see you. What does Tony write? I have grade 2 chondromalacia. Do you think I can still practice professional soccer after good treatment or rehab? So this is a good question. Actually, we're going to end on this because this is a good discussion. Chondromalacia is a term we don't use a lot anymore, but literally it means softening of the cartilage. What it's really become is an overload of pressure, typically on the kneecap, the undersurface of the patella. And I actually had this badly in college and med school, so I know how uncomfortable it is. It's not something that typically needs surgery, but it needs a lot of work with a physical therapist. Getting the certain quad muscles back, getting certain hip muscles back, maybe stretching the hamstrings. There's different causes for different people, but it's something that you absolutely can overcome. Now the question of can you still practice is the interesting thing. And let me just give you some anecdotal stories from my practice. So I think, because I still ran through mine. It may have taken it longer to get better, but I wanted to run, so I did it. The physical therapist, a lot of times when I'll tell the patients, yep, you can still run or you can still play soccer, the physical therapist will then tell the patient, no, you're better off stopping what you're doing for 2, 3, 4 weeks, however long, doing all you can do to get over it with the physical therapist, and then it'll go away faster. Maybe that's true. But having said that, pro soccer, it's a little hard sometimes to take 2 or 3 or 4 weeks off. So I'm generally okay with trying to play through it, maybe modify practices and stuff, but I'd be very, very aggressive doing it with physical therapy and not just trying to do home exercises. Mohammed, you're very welcome. Thank you guys so much. I so much enjoy interacting with you guys. Makes this all worthwhile. Remember, I've got an entire channel. I've got easily 150 Ask Dr. Geier videos, probably more than that because I'm up to well over 400 videos now. So definitely check those out. Whatever your injury is, I'm sure there's an answer in some of those videos that can help you. And I do these every month, so definitely check those out as well. Typically Tuesday nights and typically around the third week of the month, but sometimes that varies. There's a link below to my email list, and I announce it a couple times when I know I'm going to be doing it, like the week before and the day of. I send out an email. Definitely subscribe and click, ring the bell so you get notified when I'm on live. Really appreciate you guys being here, and I look forward to seeing you soon. Thanks a lot.